So good evening, everybody. This is one of the topics which every orthopedician should know very well, but many actually don't know very well. So we are going to talk about bone structure and its significance in clinical practice. Over to Professor Sudhir Kumar sir to give some insight on understanding this basic thing as an orthopedician. Sir.
Well, welcome to Dr. Ravinder Dimri on this very basic structure of the bone, which is indeed one of the most dynamic structure of the human body, which is every now and then so quickly that what we are today, we are different tomorrow or the next moment. So such an interesting subject, which is indeed in depth to understand the basic thing. And that gives a very interesting connotation to orthopedics.
Good. You can write.
I'm indeed very glad to welcome Dr. Dimri, who is going to dwell on this topic. My best wishes and welcome to him. Thank you.
Thank you very much, sir. And now I'll request Dr. Anil Dhal, sir, to put in some words. If you don't know the normal, how will you know abnormal? So we're going to talk about bone structure.
So very well said, very well said. And I think Dr. Dimri, I'm sure, is going to deal with both the normal structure as well as the abnormalities which we keep on seeing. Some of them are very common, like the osteoporotic bone, and some of them rare, like the osteoporosis condition, where the bone is very hard. So the orthopedic surgeon needs to understand what is the problem at hand, what sort of a bone structure he's dealing with, and unless he addresses himself at the conscious level, he is likely to fail in his endeavor, whether it is fixing a fracture in such a bone or treating them conservatively. I think with these words, I would be keen to listen to Dr. Dimri to what he has in store for us for this Friday evening. Dr. Apur.
Thank you very much, sir. And now few statements from Dr. Gopa, sir. Sir.
Good evening, everybody. The topic is a very interesting one, the bone structure and its clinical relevance. Unless we know the structure of the normal bone, we will not be able to deal with what is happening to the bone in everyday practice. Second thing, since it is for the postgraduates, this is a common question that is asked, and therefore we are all eagerly waiting to hear from Dr. Dimri regarding the clinical relevance and the structure of normal bone. Thank you.
And finally, before sir starts, Dr. Ajit, sir.
Good evening, everybody. I think, as we all know, the bone is the framework upon which every aspect of our daily life revolves, and upon which our knowledge of orthopedics and trauma is based. And I think it's very vital that all the youngsters, and of course all the practicing surgeons as well, are well versed with the basic fundamentals of osteology, as well as the newer concepts that are coming in terms of managing fragility fractures and so forth, which is now becoming a worldwide phenomenon. With these words, I hand you back to Dr. Apurva.
Thank you very much, sir. I must confess, when I was a resident, I underestimated osteoporosis. But into my practice, I realized that it is so important to understand these aspects. Sir, waiting to listen to you.
Thank you. Thank you very much, everybody, for a very kind word. And I hope for next 30, 40 minutes, we can just do justice to this time you've given to me. So, as Professor Gopakumar said, this is a very important topic from exam point of view, not only in your viva and discussion of cases, but even as a clinician, we if we start looking things slightly different way than the standard etiology, pathology, clinical feature investigation management, if we go behind that, even before that, what is happening at cellular or histological or molecular level, probably it will be better for us to understand the disease and maybe plan better, and sometime more to do with what not to do rather than what to do. So with that background, we will cover this seemingly dry topic, but try to make it as interesting for exam and as interesting for clinical use. So let's start from very beginning, that what is bone and what is clinical relevance. So when we come to a structure like that, like Professor Dull was saying, that this is osteopetrosis, and normally we don't go behind it. What is osteopetrosis? We start from here and just to start rattling from etiology to management. But let us think what actually is the problem in osteopetrosis, or for that matter, in the opposite, osteoporosis. Or let us start thinking about that. This young child with a tibia fracture, you can see over months it beautifully united and then beautifully remodeled, and which we expect in children. To some extent, we will expect same in adult, because we know we all treat orthopedics, and we have a significant criteria for accepting fracture. We never want fracture to be the aim is never for anatomical reduction unless it's an intra-articular fracture. Aim should be minimal damage to circulation and have an acceptable reduction, because we know that nature is in our favor and this bone will remodel. But at the same time, we have to understand that if this bone beautifully remodeled, what happened to the bone on the right side, this this pagetic bone, once it is bent, it remain bent, never remodel, in fact keep on bending more, and quite often start getting those micro damage and cracks, and leads to fracture. So what's the difference between these two bone? Why one is remodeling and one is not remodeling? So we'll look into that. We'll also look into this, that we're treating a lot of osteoporotic fractures and we're making these cortex white and nice, thick looking. But at the same time, if you continue treatment 3-5 years down the line, we started seeing that we're getting these stress fracture type lesion, and even with minimal trauma, these are breaking. So what had gone wrong when we were thinking that we're treating these osteoporotic fracture with bone building, whereas if you keep on treating them, it's going the other way around. So we need to understand this, what is going and at this level. Similarly, this osteopenic bone with a compression type pseudo fracture or milkmaid fracture, we need to understand that if this is not mineralized, what is the role of mineralization? How does mineralization happen? And if it is deficient, then why do we get these kind of things? So all these things will come if you understand the bone. Similarly, we know that this is a case of osteogenic imperfecta, but actually, we what is wrong here? What structure of bone is wrong, and what is happening in the recent development to deal with those structures? Similarly, on the right side, uh, what are the current medication to treat them, and why do we have started seeing these so-called zebra sign or multiple stripes? So what are these happening, to understand the structure of bone and how we meddling with it? Very similarly, you see the bone in the proximal femur, and you see a particular trabecular pattern, sometime very prominent, sometime not prominent, sometimes some weaker area of so-called wall triangle. Why this happen? Why do we get these kind of trabeculation? And all these things will be understood better if you know how bone is anatomically, histologically, and physiologically and molecular level do in different physiological loading. So we will go to that today and discuss that. So let's start.